I also must say that I don't in any way represent the Right to Food campaign, because the way the campaign is, there's no such thing as actually, speaking for the campaign. I can only represent my own personal experience in the campaign, which has taken me, I've been there for, 10, 12, 15 years and have occupied a specific role, I would think, in bringing child health and child nutrition, malnutrition within the campaign, and working with the campaign on these issues in particular. I must say also that my own work on the right to food and malnutrition goes beyond, is over and above the campaign as well. I think that most of the work that I have done in recent times has been with PHRN. The point to make really is that work has always, or one has tried to make a very conscious effort to lead into the right to food movement. And so these situations and these loci of work are really not very distinct, and that's, I think, one of the points that one would really try to make through this presentation, that a particular way in which we can involve ourselves with social movements and social campaigns, and why that would be of value. So how many people here in the audience? This is a thin audience now, and many people are colleagues and comrades, and who've been through and who have been working in movements and for many years, as long as I have, longer also many, and probably this presentation is not at all required for them, because they've been through all this themselves. So I just wanted to know how many people here feel that they have not been a part of a social movement or a campaign. I would also quite like the lights on, because it'll be easier to see. So anyone who feels that they haven't participated in social movements and campaigns? Right, some hands at the back. And some students are there, which I think you're busy studying. And so it's really, I guess, this presentation is a pitch for those people. So, I think the first thing that we really need to, anybody who's been linked with campaigns and movements knows that it's a huge effort. It takes a lot of investment of time, energy, over and above your whatever you may hold as your job, your employment, your family, your personal kind of ambitions for yourself and what you want to be doing with your own life. And unless you have been one of the lucky ones where your entire package of your life kind of is able to collapse into your movements, which is possible in certain phases of our world and our being, but is very much, I think it's very difficult today, for example, very much more difficult for that collapse to happen today than it could have happened many decades ago. So unless you're one of those lucky ones, it really takes some extra being and extra doing to become part of social movements and campaigns. So you've got to be fairly convinced of why you want to do it in the first place. And while we all have some sense of it, and especially those who've been part of it, definitely nothing that I'm going to say is new to them. It's good to be able to articulate why, as researchers perhaps, or as academics, or as doctors, or as lawyers, or as teachers, or as women who are working in households with their own families, why is it important for each one of us to somehow make that extra effort? And it is a big effort, and today it's even a bigger effort than ever before, to become part of social movements. So what I'm saying reflects on the previous, whatever I wasn't there on the very first day of the conference, but a lot of what has been said in the last 2 days, you're going to find it fitting into this experience with the Right to Food campaign as a case study of why campaigns and movements are so critical. And so these words have been said in the very last panel that we heard. If we understand and believe that health is a matter of politics, and really that is the root of it all, and the rest develops from politics and is secondary to politics. If we believe that health inequity is a matter of power differentials, again, the word politics and the word power came up in the previous presentations quite sharply. And so power differentials, which are again maintained by politics. So inequity is maintained by politics, it derives from politics. And to break it a little bit down, inequity is created by power differentials. Then you understand, or you start to understand, why you need campaigns and movements. Because, so if you're speaking for the marginalized, most vulnerable, they also, as all presentations previous have shown, are also powerless, relatively powerless. They have their own power, but they're relatively powerless. And creating health equity is a matter of shifting power, then where will that power be derived from? So that power obviously would not be derived from those agencies that are creating the power differential to create and maintain health inequity. So then where would that power be derived from to change this equation of power? That's the question that we really have to ask ourselves. What do we have that we can grab, take, create and conglomerate to shift this equation of power differential? And that's, I think, really the answer to why we need campaigns and movements, why as individuals within our own sectors, within our own disciplines, within our own skill sets, we are never going to be able to find enough power, but through these campaigns and movements, in our experience and our collective experience, we can, we do, and I'm sure we will. So what are the seminal kind of platform advantages for achieving equity in health that a campaign or a movement can give us? And this byline, achieving vertical and horizontal expansion, is something I picked up from the private sector. So that is how they capitalize on their profits, So if you run a hospital, then soon you will start a pharmacy also, and you will soon start to produce gloves also, and you will soon start to produce syringes also, so that the entire chain of events will give you your profits. And you do a horizontal expansion also, which is a geographical horizontal expansion across tiers, even across allied sectors, maybe medical education. So you create a very focused vertical kind of chain, and you also invest in a horizontal building of environment that will help that focus chain make its profits. So I think that is also the key strength of campaigns and movements, that we are able to achieve this directed, vertical, powerful kind of strike on various issues, as well as be able to design this shift in the larger environment that helps this vertical kind of thrust achieve what it's aiming to achieve. And how does it exactly do that? So I want to speak of the voice and representation last, because I think it's very, very important to why we must participate in campaigns, and I really want to give it its due space. But to continue on the line which I'm developing on, which is this vertical and horizontal expansion. So maintaining intersectorality, for example. I mean, we are not party to government, we are not party to the multinationals, we are not party to necessarily to political representatives and political parties. If we are representing the space or trying to represent the marginalized, the left out, the poor people and so on, whom we are trying to speak for, then how do we create intersectorality? It is only by being able to get together in a room like this, in spaces like this, and talking to each other, because if we just examine which are all the disciplines that we come from sitting here, possibly here it's all health, or maybe health and very closely allied, but in a campaign it would not be. In the campaigns such as Right to Food movement, you would find people from trade unions directly, you would find lawyers, economists, you would find some doctors, very, very few. Doctors have not historically participated, apart from Jan Swasthya Abhiyan. I think very few doctors are found in other allied movements. We would find women from feminist organizations. So you would necessarily be occupying the same physical space, and this idea of occupying the same physical space is, I think, very important and very critical, because it's only by doing that you can exactly bounce views off other sectors, other disciplines, and face the very genuine, valid differences of opinion that are going to come about, and to go into negotiations and arrive finally at consensus. So it's only by occupying those physical spaces, which really, to my mind, I mean, it's becoming useful and important and perhaps inevitable that because of the costs of things and the distances that are involved, now more and more we are going in for digital kind of, exchanges. But I'm old-fashioned. I really still feel that somehow we need to physically get together to make campaigns and movements happen. And so that's one part of it. So how do we arrive at intersectorality and maintain intersectorality? Again, by dint of the same physical presence of these various people who are representing different issues and different sectors and different segments, you ensure attention to the most vulnerable. You defend and retain the notion of rights as against benefits. We've heard about consumers, we've heard about also beneficiaries to the health system. But I think it's only movements which would be speaking the language of rights and just entirely taking away this idea of how to reach services to people better, something that I was trying to raise as a comment previously also. I think defending the space for human rights in health, something that again we learned a lot from the HIV campaigns for health in particular, that many issues that traditional health movements and also the right to food movements and so on did not really look at were the human rights issues. We sort of focused on basic needs, basic entitlements, but it's only, I think, by dint of, again, this collaboration that we have learned that human rights, democracy, privacy, all these issues are extraordinarily important. And you can see now that the Right to Food campaign, the way it's dealt with the Aadhaar issues, for instance, and using some of these human rights values, which are still, I think, not, they don't have that much purchase yet, but they are at least becoming important, and they're being articulated. I think foregrounding decentralized community-based approaches, because who else would develop these alternatives? Who else would develop an alternative policy? I think Professor Viroj was speaking about an alternative policy in some sessions. We have alternative economic surveys. We have alternatives to all the current existing acts and policies, and many of those have been developed by the campaigns that one has been working with and talking. So where would those come from if we did not have campaigns and movements? If you need to do that vertical shift in things, there's so many little things, little pieces of the puzzle that need to come together, which require such a high level of skill and expertise. How can any one organization, any one body bring all those dots together to be able to push hard and fast enough to make a change in policy or in law or in implementation? So again, it's really the campaign and the Right to Food campaign. We've done that very ably because, as I said, the combination of grassroots activists, of economists, of doctors, people who nutritionists, people who understand technical issues but understand it from one particular perspective, which is a pro-poor, pro-people kind of perspective. You can only gain that kind of expertise by collaborations of this variety and working together. And I think the most important, but what in the campaigns we haven't been so successful at, I mean, it's a sad thing to say, but that is voice and representation. I feel so strongly more and more now, since in the last few years I've been working very directly with women in particularly vulnerable tribal communities and tribal villages. I feel so strongly now, even when, say, almost 25 years ago when I stepped in as a doctor, I just thought that I would be a doctor working for poor people. But literally one had to break down one's entire set of preconceptions, of attitudes, of understandings. Literally, it all had to be painfully broken down, piece by piece, and reconstructed. Maybe not the technicalities, not the facts of not the facts of medical science, but in how it would apply and what it would mean, and in many instances also the facts. To have to challenge, your textbook of something or the other, to challenge WHO, to challenge UNICEF. All that literally had to be done painfully, slowly. And the only way really that I believe it can be done is that in some point of life, in your history as an academic or researcher or whatever, you have to work directly with the people you came to represent. There's no getting away from it. And since all of us can't do it all the time, again, being part of platforms and campaigns where at least some time is spent directly face-to-face experiencing or attempting to experience, we can't do it. I mean, I cannot claim to ever experience the reality of the woman with whom I'm working. But at least that attempt should be made. And so working directly, giving voice and representation is, I think, critical to campaigns, critical to social action, critical to our work as researchers, if we intend to shift health inequity. And that really is enabled very powerfully by aligning with campaigns and movements, not least because somebody or the other is always attacking you, always questioning you, always challenging you, always saying you're not doing enough, you're not enough, you're too elite, you're an intellectual, you're elite. So if nothing else, you're constantly facing a barrage of questioning, self-analysis that results from that kind of a barrage, and trying to find and locate yourself within that, and trying to make sure that at least your direction is met wherever you are on that road, but you're moving an inch forward every time. And I think nothing but that kind of peer collaboration, which can be so questioning, which can be also so bitter, which can be so challenging, can really bring that transformation as a social activist, as a health person. But we don't do this enough. I mean, even today in a campaign meeting, do we actually find a tribal person? This conference, for example, I mean, I'm saying this not from any kind of moral high ground or anything, because we ourselves, we are trying to create meetings all the time, create spaces for dialogue. In how many have we ever, what would this meeting look like if there were tribal participants? It would look so very different. It would have to be so very different. And unless we experience that difference, we cannot even envisage what kind of different country, different society, different laws, different programs and schemes we would really need. If you don't experience the challenge of that, like in my vision of the world and society, for example, I was telling Mohan yesterday, religion displays no role at all. No role. If I were to create a society, there would be no religion. But the people I work with, religion is ingrained in their daily, minutely existence. And if I can't engage with that in some manner, if I can't negotiate with that in some manner, if my ideology prevents it, or the barriers that I have within me don't allow for that, then I can't really make that change. So I think the fact that there's so much difference between us and the people that we are talking to, talking about, talking with, that difference, the more we experience it, the more it's going to help us to arrive at what it is exactly that will lead us to health equity. And I think that only campaigns have that potential, even if they haven't fully realized this particular potential, they do have that potential. So now just coming back to Jan Swasthya Abhiyan and Right to Food campaign, I know Jan Swasthya Abhiyan was not listed as something that I should talk about, but essentially my journey into the Right to Food campaign happened through Jan Swasthya Abhiyan and through our work as FORCES, Forum for Creches and Childcare Services, which was located in mobile creches, which worked with the children of construction workers. So, but JSA made some, wise choices about it, which is to come back to the issue of why, how determinants, social determinants of health are important to health. So, in Jan Swasthya Abhiyan, this debate always went on that are we going to talk only of healthcare services, or are we going to talk of social determinants of health? And because the Right to Food campaign was working on the right to food, it was debated and discussed quite thoroughly, and then it was decided. Literally, I mean, we sat in rooms and we discussed this, and then it was decided that since Right to Food campaign is taking the lead on the right to food, and we believe in it, let us organizationally support that, rather than creating any parallel, work on the right to food. So as Jan Swasthya Abhiyan, we would continue to support and link with the Right to Food campaign, and we would try to add value inputs from the point of view of health care, to understand it as a technical issue and so on, and systems, healthcare systems, how those would correlate with the right to food. And malnutrition is actually the it's the perfect combination that requires an understanding of right to food, as well as technicalities of health, what is SAM management, and that comes into play. If I have time, I'll go into, what we have done on community management of acute malnutrition, because that is where a lot of these issues that I'm talking about, they came to be symbolified in that arena of community management of acute malnutrition. So a working group for children under 6 was formed, which was formed with key participants from the Right to Food campaign as well as Jan Swasthya Abhiyan. And this took a lot of leadership in both Jan Swasthya Abhiyan and the Right to Food campaign to highlight issues of malnutrition, particularly around children, because that's another thing that I wanted to say. There was somebody, I think it was Nakir, in another conversation talking about people wanting to be left alone. The fact is that we are not in that ideal space where that's happening. Somebody is always acting upon somebody else. There are forces always acting on somebody else. If we, the campaigns and movements, choose to leave people alone, well, certainly the market is not leaving people alone. Certainly the powers that be are creating, the miners are going in and going to do their mines. So there is that balance that has to be maintained. It's not easy. It's not also like, Jammu and Kashmir, leave us alone. We don't want to be with Pakistan. We don't want to be with India. We just want to be with ourselves. But in the real world, it's not really like that. So there is no leaving alone. So what we were responding to at that point of time was a very global international pressure to say India is a house of wasted children who are dying, and therefore we need to do XYZ, very precisely XYZ for these dying children. And that XYZ really was housed around a product called ready-to-use therapeutic food, which came from a particular company at that point of time, which was Plum Peanut, which all had to be imported in $12.8 million US, worthy of imports that came. and then finally were thrown out and thrown back, not necessarily because of the campaign, because the government got miffed that they weren't, asked, they were not nobody took their permission, so nobody took due permission, and subsequently the campaign has really been working on that. So it was very opportunistic, and it was very reactionary in some sense also to what we had to fight at that current point of time. So the working group for children under 6 continued to develop on the theme of what actually we should do for child malnutrition, and try to take it right back into the furthest possible, the most distal social determinants, as well as the most proximal ones. I mean, we had to fight on all those fronts. The most distal meaning labor issues, maternity entitlements, the lack of daycare, creches, bring in all those issues, bring in agricultural crisis, bring in what's happening to millets in this country, bring in how the PDS is functioning or not functioning, bring in the fact that no millets are there in the PDS, bring in the fact that eggs are not being given in midday meals and schools because of some religious notion that we're all a vegetarian nation. So all those elements which are sharply political, and that brings me back to something of great value that somebody said, I think it was Sharon, that implementation is not devoid of politics. It's not just theorizing and the large policies that carry politics. It's the way in which every little detail of that policy is also implemented that has the scope to carry politics if you yourself are aware. So when I say working at grassroots, I must qualify that working at grassroots but with an analytical perspective. Not either one or the without is, I mean, if I had a choice of only doing one, I would do grassroots. If I could do both, that's ideal. But certainly just having analysis without the grassroots is not really great. So working group also worked with the government. At that time we had the opportunity in UPA 1 to work with the Planning Commission, work with many ministries and so on. Also work with the NSE on the formulation of the Food Security Act. And so it had a lot of opportunity, which was, again, because of the political dispensation being slightly favorable, which is one of the reasons why it's completely out in the cold now, because anybody who's in any way associated with any of those institutions in the past government are now completely finding themselves out in the cold. So as I've said, we took care of distal determinants as well as proximal ones. I've just listed some of those. These are some of the examples. Again, I was giving the examples while I spoke, so I'm really almost done with what I needed to say. But just to again spell it out, what were the areas and arenas which we had to fight off for using CMAM to demonstrate exactly what we meant for the right to food, from its most distal to its most proximal determinants. And there are some papers that we've been publishing. One is coming out in Indian Pediatrics next month, and I'm particularly proud of that. So challenging the definition itself. So this is WHO, UNICEF, who created a definition of community management of acute malnutrition, which said that they are downward extensions of a medical facility. Where is community in this community management of acute malnutrition? And how come nobody ever said, how dare you use this term community in this sense? Community's only role was to participate in the sending of their children to some, nutrition rehabilitation center, or to acquiesce to being given plumpy nut, to allow it, to agree to it, to consent. That was the entire role for community. So where were we as, community health people, not challenging a WHO and UNICEF definition? Even today, it's, very few voices are actually doing that. To actually create community-based models, to say, yes, it can be done. It can be done, it can be successful. To produce that evidence, because there were RCT after RCT coming from Africa and so on to say that, it won't work, you're going to be killing children. Then to demonstrate that children are not dying. In our country, children are not dying, they're living with malnutrition, but they're not dying. Now there is plenty of evidence to say mortalities are very different in India as compared to previous experiences in Africa. So everything we said, we had to substantiate, creating our own evidence, because nobody else is doing it. UNICEF was certainly not doing it, WHO was not doing it. None of the big donor agencies were doing it. And we had to struggle, and there was no other way of doing it except for the campaign coming together. Because where do we have the resources? Where do we have the human resources or the money power to be able to do this kind of work? If we didn't, if I were to cost the amount of voluntary effort that has gone into this whole exercise from people who could charge, international rates of whatever it is, I don't know what is current today, I don't know how many $1,000s a day people charge as consultants. If I were to compute that, it would go into crores and crores of rupees of how much, effort has gone into this whole thing. So we publish, because really, unless you publish, Professor Viroj is going on and on talking about his publications. It's so critical, because if you have to fight this power without publishing, and then that kind of effort, because I know so much good grassroots work that's happening, but it's not being able to publish. This is where collaborations come with, research agencies, and it's very important to put in that extra mile effort to publish, to be able to fight this battle. Policy advocacy with governments, I've already referred to it. There are these documents which you can all look at, if you really want details. And then fight corporatization, centralization, minimalism, fight of RUTF with evidence. Say if it's not for RUTF, what other food products can communities create? So we had Aam Sattu and so many other examples of what other foods demonstrate the nutritional value of that food, then demonstrate its efficacy and its impact. Defend freedom of choice. Just now we're really pushing eggs. Eggs have become symbolic of this entire battle, because it's something decentralized, it's something communities can do. It can be produced, in a decentralized fashion. It carries this whole thing against vegetarianism. So eggs, and we are also speaking quite openly about the choice to eat beef, where I'm sitting in Kerala, and there was some beef on the table yesterday. Create an informed mass of affected people. So I think ground level mobilization is particularly problematic just now, except on, I think some issues are very upcoming. Labor issues are coming up very strongly, and we really hope to be riding on labor issues and combining health and labor issues more strongly as a strategic kind of thing. Bring on the political agenda, keep trying. And the judiciary. I think this particular campaign has used the judiciary very, very well, sometimes serendipitously, but we have used the Supreme Court case on the right to food from 2005 onwards very well. And then to some extent the Food Security Act. Today there's an editorial by Jean Reyes in the Times of India, I think, on the failure of implementation of the Food Security Act. So in all these elements we have struggled. So policy, law, programs, implementation, resistance, accountability, social audits, the entire combined horizontal and vertical of what we need to do on labor, on education, on health, on food, on water, on agriculture, all these issues together only through campaigns. So thank you.